Assalamualaikum and hi class. Very good evening. Welcome to healthcare information system subject. Today we will discuss on the chapter 4, the healthcare data part 2. So previous chapter we cover the healthcare data part 1, which is we discuss on the data nature in healthcare, yeah, how and what type of nature of data normally uh, include in the healthcare information system. So we also discuss about the information exchange in the healthcare system. Yeah, how the data is transfer from one department to another department, or from one services to another services for provide the treatment for the patient, for a patient. And then in part 1 also we discuss about the healthcare data type, uh, what kind of format of the data that we can generate or we can collect from the main source, yeah, for example from the laboratory. So what kind of data type that we can define, and then what kind of data from the radiology, what kind of data type from the radiology that we can generate the patient medical record. Okay, so this need to uh, you need to understand, yeah, where the data is come from, and then you analyze what type of the data. If the data involve images, so you need to define it in your database as images data type, or the data type, yeah, the type of the data is text based. So you need to find what is the length of the data, how long the data is, yeah, the maximum, so you can provide a correct space when the health worker generate the data into the database. Okay, this is a information exchange in generating the healthcare data in the healthcare system, yeah? From nurse, from the doctor who treat or who provide the treatment to the patient. Yeah, uh, it also involve the laboratory, yeah? Where the laboratory will do the ordering examination. It come from the doctor and also come from the nurse. Yeah? When you got admit to the hospital, so every day the nurse will take your blood sample or blood uh, specimen and send to the laboratory to check your glucose or your cholesterol level. Okay, and the doctor also contribute to the generation of the healthcare data, especially the clinical data. So when he or she visit the patient, so maybe on certain condition of the patient for that day, so the doctor will order some uh, examination, yeah, to the laboratory. Okay, finally the data. So this process involve the clinical information, clinical data and clinical information, and become the knowledge. So finally, after the treatment is finished and the doctor decide to discharge the patient, so if we go to the financial department, Yeah, all the tests, all the uh, image uh, examination procedure done, what charge will go to the financial department for billing purposes. Okay, so this is a previous chapter, part 1, and we also discuss on the data source, yeah, where the data is generated. Like I said previously, from the radiology, yeah, imaging, imaging data, financial supplies, hospital department, administrative departments, and also the laboratories. Okay, and finally, we discuss also on the method, how the data is collected, how the clinical data is collected, and generate the patient medical information or patient medical record. So we mentioned that a lot of clinical data is come from the doctor patient consultation. Yeah, so doctor will jot down, or they call it clinical notes. Yeah? They will write the clinical note or plug in into the system, especially during the physical examination, direct measurement, laboratory examination. When the doctor get the result from the laboratory, so they will write a report. Also, radiology test result. So the doctor will analyze the result, and then they will put the comment, okay, on the finding during the uh, yeah, MRI, for example, yeah, X-ray, or for example. Okay, this chapter, chapter 4, we call it data. We still in the healthcare data, but it's part 2. So this chapter is actually to uh, teach you how to categorize the healthcare data into several components and usages. And we expect that at the end of the chapter, you can identify the healthcare data model. Then you able to define the healthcare data dictionary, and then you able to select the suitable database system for healthcare data system. So this is a process where you model the data to be uh, your what we call it, to be your table. Finally, you will create the table, or you create the a flat file if you don't use the database system. Okay, but the most important thing during this stage is you need to model, or you need to discover the entity of the healthcare data. Because I already mentioned before, the healthcare is data intensive. Yeah, it involves a lot of data. Even a moment you entered the hospital, so it will generate the data. Yeah. Okay, first, before we go into the part 2, actually I want you all know how to actually how you want to uh, discover, especially how to discover the entity and also the attribute of healthcare data component. Okay, so before you start to discover the data dictionary, for example, before you come out data dictionary, of course you need to model the data, or the information involved in the healthcare system. Okay, So in order to come out with the data model or data dictionary, so you need to understand the process of the healthcare flow in certain department or the overall of the flow in the hospital. So I give you a very simple workflow that normally involve in the hospital. So we call it consultation workflow, or we call it outpatient or inpatient workflow. When patient visit the hospital, so this is normally the workflow that they will go through. Yeah? Firstly is registration, and then after the registration, they will go to the examination, and examination means so either the paramedic or nurse check him or her regarding regarding patient health status, uh, and then after the pre-examination, for example, after the nurse take the blood pressure reading, and then the patient condition is normal, uh, no need for the emergency treatment, so they will pass this patient to the doctor, and doctor will do a test or interpretation, and then doctor will finally diagnose, uh, decide whether this patient got what problem. Okay, and during the diagnosis or treatment, normally doctor will decide whether this patient need to be admitted for acute treatment, or the doctor can provide a normal what they call it outpatient treatment only. So after they got the drug, then the patient can go back to the house. And then after the consultation, of course, doctor will prescribe the drug, and then after the patient collect the drugs, so they will go to the billing department, and maybe at the billing counter, the patient can do a follow-up appointment, and then patient discharge and go back to their house. Okay, if let's say the admission is required, so they will go to the uh, admission counter, and then the patient will be admitted to the ward. So you can see that at the left side is the flow. Okay, it's the flow uh, of the consultation, or flow for inpatient or outpatient for uh, a certain visit of the patient. So at the right side, you will see that the candidate application system. So this is a computer system. So you can see that during the registration, so the candidate application, we can say that this is a patient management process. Registration involve the patient master index, patient ID, visit time or date. So we can say that, so this is under module patient management system. So when it go to the examination, when we talk about examination, that the doctor will attend this patient, and we can say that, so the examination is the CIS, clinical information system. So under clinical information system component, uh, it got lot of sub component. For example, select queue, plug in the subjective information, objective information, assessment information. and the doctor during the CIS process, this one, so the doctor will order the investigation to the radiology department or LRS. Okay, so this one, test and interpretation. So this we can say that the candidate system or this process is mapped to the radiology or LRS. Okay, or we send to the operation theatre, for example, so it involves the procedure information system. Okay, and then the next step is diagnosis and treatment. So this is also fourth candidate application system. So when you talk about diagnosis and treatment, normally involve the doctor. During the consultation, doctor-patient consultation, they will diagnose this patient based on the information they got from the test and interpretation. So these also considered under CIS. So you see that many workflow can be mapped to one system, or one candidate application. See, number 2 and number 4 is under CIS. Okay, so why I show you this step is to make you make yourself easy to understand the how to translate the workflow of the application into the system. Okay, sometimes the software engineer, the student, uh, they don't have the experience how to develop the system, so they cannot imagine what is the module to be developed, what is the module to be translate from the workflow. Right? So this is very important. When you develop a system, you need to understand the workflow and you map to the system to be developed. Or otherwise, you develop a system with or without purpose. Okay, so you just have a computer system, but you cannot. But your system actually cannot have the business process of the uh, healthcare system in this context. Yeah. So the objective of computerization is to improve the process. Yeah? If you develop a system same or bad from the current system, so this is a considered failed system. Yeah. And then admission, you go also to ADT. ADT mean admit, discharge, transfer, or ward system. Okay, and then drug dispensing. When we talk about drug dispensing, so we can imagine that okay, drug will maintained by or responsible by the pharmacy department. So we call it pharmacy information system. Yeah, to manage the administration of the drug order and drug stock in the pharmacy department. And then we talk about the process to generate the billing and payment. So simply we can say that this process can map to the uh, billing system and also the patient management system. So uh, this we can say that billing involve patient management system and also the billing. So I miss one module here, billing. So when you discharge when the patient is discharged, so it involve physical discharge or virtual discharge. Virtual discharge mean the system will indicate that this patient is already inactive. They mean inactive for the visit for the visit for the day. Okay. So active mean the patient is still in the system and still under treatment. Okay. So this is also under CRS and PMS. PMS mean patient management system. So we need the record of the patient, and CRS maybe it will link to the doctor. So only the doctor can say that okay, this patient can be discharged or extend their stay in the hospital. Okay, so that's why here we got CRS and PMS. So when we put two systems, so of course this module need to be integrated. So the final destination of all this application is to generate the electronic medical record. Yeah, you can see that all these application of healthcare information system, the main purpose is to generate the electronic medical record of patient. So this process is very important for you to understand. Every time when you talk about healthcare information system, you go uh, to the workflow first, and then you can imagine that what are the system to be developed. So from the application, this is a candidate application that we can use as a what we call it a module. Then from that we will start to construct the to construct uh, what they call it to construct the data model, yeah, for the healthcare information system. Okay, from that, yeah, from the PMS, CRS candidate of application, where we get from the analysis of this workflow, so we can categorize the health record component into three main components. Yeah, so this is a Malaysia perspective. Maybe you can, if you check with the HR7, the health record component, maybe it's slightly different, but uh, the core of the health record component uh, actually categorized into three components. Patient information, health condition summary, episode summary, and I miss here one is the administration data. Yeah? Example, billing, yeah, dietary, and etc. So this is a result from the analysis of the uh, consultation workflow or inpatient or outpatient workflow. So from this process, so we can categorize that the health record component divided into three components, the big component. So this is a Malaysia perspective. So you can uh, create your version of health record component based on your analysis. But this is from my experience and analysis regarding on Malaysia perspective. So this is a data component that we group, and this is normally the data uh, is generated from from this process. Yeah. Okay. This is a route how to come out or discover the data table or your table. Finally, your column or your what we call it entity and attribute lah. Yeah. Okay. From this generic or core component, so uh, I give you a tip how to come up with the or how to discover the data model or data structure. of healthcare data, you start to model the functional component first. Let's say you start with the PMS, for example. So here, so you got the PMS. So you start to decompose what is the subcomponent under PMS. Maybe under PMS, patient management system. So we need to register the patient first. So this is under registration module. And then we need to maintain the patient information. So we should have a submodule, they call it patient biodata. Yeah, patient biodata registration. In order to register the patient, so you need to plug in the patient biodata, or you need to view the patient biodata. And then maybe the additional information for the patient biodata. So, or you want to know about the next of kin, further information about the patient. So you enter the next of kin of the patient. So next of kin is very important in case happen to the patient. So you have a contact, you have a person to be referred. Let's say this patient unconscious, and then you can get the next of kin information, or family information. Then you can contact their relative, regarding the patient. And then employment information, insurance information, and also the queue management. When you register the patient, and then you send this patient to the queue, specific queue, whether you send to the doctor queue, or facility queue, or common queue. So this is tip, how you model the functionality. And then from the functional component of the patient management, you start to start to discover what are the information involved in the uh, patient master information. Example, patient biodata. What is the information required involved in this entity, for example? What is the uh, attribute involved in the next of kin? So you just list uh, the candidate entity that involved in the PMS. So from this module, so you can imagine that. So you have a registration number, for example, you have the patient ID, patient master index number, IC number, gender, race, and so on. Okay, and then you list the entity. Okay? If you don't know what is the entity and attribute, so you just list down all the necessary information, right, for you to provide information about the patient biodata, for example. So what make this patient biodata alive, or you can use this patient biodata? Of course, you need to add the ID, race, yeah, to complete the data, and to ensure that the data become information. Okay, so you just list that next of kin information, medical insurance. Okay, so this entity, then you go to the detail. Okay, this is ERD, and entity relationship diagram. So you expand your entity. For example, is a family history. So this is their attribute. Okay, so this ERD is not complete 100%, but at least you start something. Yeah, you already model what is a primary key. For example, patient master index number, ID number, Okay, let's say you don't have any idea on organ donor information, so you just leave it and focus on the main entity first and main attribute uh, to make up the entity. Family history, for example, what is the attribute uh, that support the family history information? So of course, patient master index number that relate to the patient master information. Let's say Ali, so they got next of kin, Aminah, for example, his wife, and then of course, patient master index number of Ali should be referred to the next of kin patient master index number. So this next of kin we link to the patient master information. Okay, family history or family information. Let's say Ali got 5 kids, so we have 5 kid uh, we 5 kid of ID, different ID, yeah, that link to the patient master information. Okay, so can you get how to discover the entity and attribute class? Okay, you start with the modeling of the functional, yeah, patient management functional. This is an example. And then next you go to the list of entity that involved in the PMS, and then you go to the ERD, yeah, and then you start to model the entity relationship diagram for the patient master index or patient master information. So this is step that you need to know. You, I think this is a very simple tip. So you start with the functional list of the entity and then construct the ERD. So this is a simple process where when you complete your uh, entity with the necessary attribute, so you can generate this ERD to the DDL, yeah, data definition language, to the specific database you select. Okay, so this is a first component of the healthcare data, which is patient master information that relate to the patient management functional component or patient management module. So another data, okay, so this is a complex, so this is a clinical data. So under CIS, clinical information system. So remember that the first uh, workflow that we model here, so examination will map to the CIS application. So we start to explore the CIS functional component. So okay, so this is a component, functional component of CIS, clinical information system, or we call it doctor patient consultation. So this module will used by the doctor. So you need to decompose this module into pieces of sub-module. Okay, so this is sub-module: view medical history, on hold the patient, discharge the patient, select patient, uh, uh, plug in the plan information, plug in the assessment information, plug in the objective information. Okay, these are all the data generated during the doctor patient consultation, or we call it submodule CIS. Okay, after you break down this module into submodule or into submodule, then you start to list the the data component. Okay, so we divide the clinical data component normally into two, health condition summary and episode summary. So episode summary is more detailed compared to health condition summary. So health condition summary normally is semi-static, like allergy. Once you got the allergy, and then sometimes allergy can be cured, or disability. So when you got age, your age uh, at 12, then you got you miss one hand, for example. So the information is very rare to update, or chronic disease you suffer. Let's say you got BP, high blood pressure or hypertension. So this information is will be created once, once, or social history. So this is very semi-static, they call it semi-static data. And then under clinical information system functional component, we also can generate the episode summary data component. So this is very data intensive. So every episode means that episode mean visit. Every visit you to the healthcare center. So this is normally information is entered by the doctor. Yep. Your once every time you visit the doctor, so the doctor will prescribe the drug. So this is under medication. So this one, medication. If you got test for that visit, okay, the test and procedure information need to be entered. Health plan. Plan means, let's say you got heart problem and doctor plan for you to enter stop smoking program. Yeah. So this is health plan. Your symptom, your vital sign, what is your weight, height, your temperature. So this is under vital sign. Okay. So after you list, same format that we can use from the previous data component, like patient master index we discussed previously. So you use this format, same format, you model the functional, you list all the entity, and then you start construct the ERD for the clinical data. Okay. Clinical data start with the patient information, and then patient information visit the healthcare facility. Yeah. So when the patient register, they call it episode for that day. And then when the patient sent to the clinic or lab, so they call it encounter. So when the doctor from the CIS order the test or radiology examination or prescribe the drug, so if we go to the order transaction, and order engine will send to the respective department, and all the order or drug, for example drug or image or lab or billing, will go to the health condition summary and visit summary. So this is a basic. So I don't want to make this ERD complex. So if we want to show you the real, so I think you cannot finish your your application, because a lot of module need to be catered. But this is a basic. What I want to I want to make sure that you understand how to develop the healthcare information system with MVP component, minimum viable product. So this is a fundamental. Okay, I repeat again. Okay, now you are in the clinical data component. So in order to discover the data component or data entity and also the attribute, you start to model the functional component. Okay, break down the module into sub module like this, and then you start to list the entity. Then after that you start to construct the ERD, where you can define the attribute for each of the entity. So this is a basic uh, attribute that I can show to you. Okay, another data component is a system administration functional. Yeah, so when you develop any system, so the system administration need to be developed, because it will maintain the lookup table. Lookup table mean the master reference, master detail reference. Let's say you need to look up the country data, state, district. Yeah, so all these data we store in the lookup table. Okay, and then the system administration also manage the user of the application. So you assign the role, responsibility, maintain user profile, assign role to the user. Okay, and then some of the specific data you need to create the database. For example, the SNOMED city. So this is a clinical term for clinical classification and so on. And then you maintain the clinical code, procedure, physical examination code, all the code that involved in your application system. So uh, you need to have a one function. They call it system administration. Okay. Same format like previous data, like clinical data. So you list all the entity and then you start to construct the ERD. Okay, and this is a clinical support system functionality. Yeah, you start to model the functional component, lab, radiology, pharmacy, operation data, and then you start to come out with the entity, lab test, lab result, radiology procedure order, radiology examination result, medication information, procedure information. Then you go to the ERD, and then you start to model or construct the ERD detail. Okay, this is a high level. So I show you in the lab shortly how we use the star UML, and then you start to create the attribute. Okay, in summary, the healthcare functional component comprise of patient master index, clinical information system, clinical support system, and system administration. So this four is a core module. When we talk about the system administration, talk about application administration. When we talk about clinical support system, it involves laboratory, radiology, billing, ward, uh, OT, operation theater. When we talk about clinical information system, it involves the doctor-patient consultation. Involve the service order. Okay, when we talk about patient master index, okay, this is involve the administration also, or they call it patient administration system. So we manage the patient biodata, we manage the patient next of kin, we manage the patient family information, the insurance, health insurance, panel, and etc. Okay, healthcare data component would divide into patient master index information, clinical information, administration information, and clinical support information, which involve the laboratory, radiology, pharmacy, and procedure. This is called clinical support. That means this department support the clinical diagnosis. Yeah, when the core function of the healthcare information system is clinical information system, doctor patient consultation. So this is a heart of the system. So the physician or specialist will treat the patient and they will request necessary services from this department, laboratory, radiology, pharmacy to get the drugs. Procedure normally involved in the OT, operation theatre. So the understanding of the inpatient and outpatient workflow could is to understand the healthcare information system requirement. Okay, from the workflow, so you understand uh, what to do and what the user require in order to computerize the system. And lastly, the healthcare workflow model easily mapped to candidate application system. So from the workflow, you can see that in the first slide, I show you the workflow, and then from the workflow, you map to the candidate application. Okay, that's it for chapter 4. Yeah, so this is regarding more on the healthcare data, how you collect, how you model the information into uh, toward the system that you want to develop. So this is very important when you want to develop a system. So you need to discover the entity and also the attribute of the data. Okay, I think that's it for chapter 4. Uh, anything if you don't understand or if you have any question, you write down in the comment, and then I will answer as soon as possible. And make sure that all of you listen to this video, and then after you complete listen to the video, watch the video, and then you can check in your attendance. Okay, see you later. Thank you very much, and assalamu alaikum.